Hi, this is Debbie Sexton reporting to you on a patient that I saw today. Caucasian female, 21 years old, initials are LW. She lives with her disabled mother. She presented with a complaint of depression, anxiety, and tightness in her chest. This started about 2 months ago and has progressively gotten worse since her 2 brothers, their wives, and the 3 children of one of them moved in with she and her mother due to hard times. She does not get along with one of the brothers, who she says abuses alcohol and drugs. Review of symptoms for LW is she denies problems with head, eyes, ears, nose, and throat. She denies palpitations or chest pain with her heart. No pain radiating in her neck, arm, left arm, or scapula. Her lungs she denies problems with her breathing, or she denies shortness of breath. She does admit eating more than she should and eating more of the foods that she should not eat. She denies excessive thirst, admits to some reflux, which she attributes to the fact that she's not taking her Nexium like she knows she's supposed to. Her last menstrual period was January of this year, 2011. She does admit to having abnormal periods and has had for a long time. She's not sexually active and she's not on any birth control. She denies any other genitourinary complaints. She denies muscle or joint problems, denies seizures or paresthesias. She denies illegal drug use herself and quit smoking 6 months ago. She denies thoughts of suicide and homicide. Her past medical and social history are that she has been diagnosed with depression and bipolar. She has asthma. She has GERD. She has obesity. And the chart reports that she may have polycystic ovarian syndrome. However, she told me that she had cystic fibrosis. She has elevated glucose, cholesterol, and triglycerides, and has been prescribed combined oral contraceptives and was given a referral to an OB a year ago, but she did not go. She's also previously been treated with Paxil and Cymbalta for the depression/anxiety. Both medications she stopped because she didn't like the way they made her feel. She's not allergic to any medicines, and she is supposed to be on an Advair Discus, 1 inhalation every 12 hours. She has a Pro Air inhaler that she should use 2 puffs every 6 hours as needed for shortness of breath. Nexium 40 milligrams a day, Lipitor 20 milligrams a day, and combined oral contraceptives. She has been taking none of these medicines, and she does have Medicaid, so she did not have a good reason for not being on her medicines. Physical exam reveals an obese female, clearly in distress, intermittently tearful. Her blood pressure was 130/81. Pulse is 86. She's 5'10" and weighs 281 pounds, which is 14 pounds more than she weighed a year ago when she saw this healthcare provider. That means her body mass index is 40. Her O2 stat was 99%. Head, eyes, ears, nose, and throat, thyroid, all within normal limits. She has mild facial hirsutism. Heart rate was normal. S1 and S2, no clicks or murmurs were heard. Her lungs are clear on auscultation in all fields. Her abdomen is obese, soft, and non-tender. She has peripheral pulses are all strong. Her gait is steady. My differential diagnoses for LW are: number 1 is depression. It may be situational, it may be chronic. with poor coping abilities. For number 2 is bipolar exacerbation and the fact that she's not on her medicines. Number 3 could be hypothyroid disorder. My plan for her is she is definitely depressed, and in this home situation, we discussed that with her as far as she and her mother do have the right to give the brothers a warning and a suggestion that they find another place to live. She's going to be put on Prozac 20 milligrams, 1 a day. She's given Atarax 25 milligrams. She can take one Q 4 to 6 hours, up to 4 times a day for nervousness and stress. She was given a 2-week supply of the Atarax and a 1-month supply of the Prozac. She is referred to mental health because they do have a program that her Medicaid would cover her. She is to return to the clinic in 1 week for follow-up evaluation on her, the benefit of the medications, and if she is has been able to make any changes in her living situation. At that time, she's to come fasting, and we will draw CMP, lipids, the CBC, thyroid, and follow up as necessary. Medications were ordered for her, the Advair, the ProAir, the Nexium, and we'll talk about the Lipitor and the combined oral contraceptives next week. Thank you.